Thyroid gland is located behind the upper and lower poles of the thyroid anterior to the larynx. Remember, all disease or syndromes of endocrine system are a result of an excess or deficit in the production of hormones. People can have as few as 2 or as many as 6 of their parathyroid gland. Function of the parathyroid gland is to control calcium within the blood in a very tight range between 8.5 and 10.5. It's used to regulate electrolyte balance, muscle contraction, nerve conduction, clotting cascade, and the formation of bone and teeth. What is hyperparathyroidism? Hyperparathyroidism is excess amounts of PTH, parathyroid hormone. Primary hyperthyroidism is overproduction by one or more of the parathyroid glands, which cause is usually an abnormal group of cells from adenoma, rarely a carcinoma. Secondary hyperparathyroid would be from a chronic disease that can cause hypercalcemia, for example, chronic kidney failure, CKD. Function of the parathyroid hormone is to increase the concentration of plasma calcium, increasing the release of calcium and phosphate from the bone. It also increases calcium reabsorption by the kidney to keep continuing to raise calcium levels. So it reabsorbs it instead of excreting. Increasing renal production of vitamin D3, calcitrol, which increases intestinal absorption of calcium. Assessment findings for a client with hyperparathyroidism. Think bones, stones, abdominal groans, and psychic moans. So with bones, you have patients that are at risk for pathological fractures. So with a hyperparathyroid, high PTH in the blood is going to cause pathological fractures, because it could be pulling the calcium from the bones to increase this calcium. Stones indicate kidney stones, which are present in 15 to 20% of primary hyperparathyroidism. Abdominal groans, they have abdominal pain with this, high calcium in the blood. Psychic moans, it's painful, this abdominal groans and psychic moans. Lab testing would show and signs of symptoms of hypercalcemia and hypophosphatemia, hypercalciuria in urine. So you're going to have increased calcium in the urine, you're going to have high calcium in the blood, and you're going to have low phosphate. Remember, calcium and phosphate are inverse. So hypophosphatemia with this hypercalcemia, hypercalciuria, that's how you're getting those kidney stones. Signs and symptoms related to hypercalcemia would be muscle weakness, fatigue, volume depletion, nausea and vomiting, hypertension, high blood pressure, bradycardia, that's low pulse, shortened QT interval on the EKG, and left ventricular hypertrophy, renal stones, depression, confusion, and peptic ulcer disease. So psychic moans are related to depression and confusion with this hypercalcemia. Diagnosis: parathyroid hormone levels can be drawn. Calcium and phosphate levels can be drawn with the lab work, and 24-hour urine for calcium and creatinine excretion. U/S cestimide study radioisotope ultrasound confirms the diagnosis. What is the non-surgical management for a client with hyperparathyroidism? You would eliminate excess calcium in the diet, can have 1,000 to 1,200 milligrams per day, because you already have a lot in the blood. Diuretic and fluid therapy. Patient needs to be provided with at least 3 liters of fluid per day. This includes cranberry or prune juice, which helps increase urine acidity and can help prevent calculus formation, decreasing the stone formation. So breaking down those like calcium stones. So you want urine acidic with cranberry or prune juice, which will help. Avoid drugs that cause hypercalcemia. Should be avoided. Drug therapy, phosphates, calcitonin, and calcium chelators. Safety precautions to minimize injury from fall. Care should be scheduled to allow patient with muscle weakness as much rest as possible with them. Provide comfort measures. Alleviate bone pain. Administer antacids to prevent peptic ulcers. And nurse should auscultate the lungs, listen to lung sounds regularly, and check for signs of pulmonary edema in the patient receiving large amounts of normal saline IV fluid, especially if they have cardiopulmonary disease. Patients should be observed for signs of pain, monitor effectiveness of pain, and monitor effectiveness of analgesics and comfort measures. What medications would you use for this hypercalcemia in the blood, high calcium? You could use thiazide diuretics for more excretion. Lithium drug would decrease that calcium in the blood. Too much antacids containing calcium. Excessive intake of vitamin A and D, vitamin D. And these are medications that can contribute to this hypercalcemia. So you need to review these meds. Hormone replacement therapy, HRT can cause this, and theophylline. So eliminate excess calcium in the diet. They can have 1,000 to 1,200 milligrams per day. What foods are high in calcium? Which they would need to avoid these. Dairy foods, collard greens, kale, bok choy, broccoli, sardines, salmon, shrimp, almonds, rice or soy milks, and oranges are high in calcium. Tofu, frozen waffles, and oatmeal and other cereals have calcium. What is the surgical management for a client with hyperparathyroidism? A parathyroidectomy. Pre-op care for this removal of the parathyroid glands. You would stabilize the client with calcium levels normalized. Studies look at bleeding and clotting time, CBC prior to surgery, teaching, cough, deep breathe, neck support, cough, deep breathe. Operative procedures, removal of enlarged parathyroid, 3 to 4 glands removed. 4th gland may be implanted in forearm to produce parathyroid hormone and maintain calcium homeostasis. Post-op care for a client with hyperparathyroidism. So post-surgery care, you would include monitor client for respiratory distress, observe for respiratory distress, keep emergency equipment at bedside, intubation equipment, bedside, monitor for hypocalcemic crisis, which could occur. They could also bounce into low calcium. Signs and symptoms of low calcium crisis would be tingling in extremities, positive Trousseau and Chvostek sign, monitor calcium levels. Patient may need lifelong calcium and vitamin D replacement. Recurrent laryngeal nerve damage can occur. So you'd assess that, like if they're able to talk fine. How would the nurse test for that? Assess client's voice patterns and hoarseness after surgery and every 2 hours thereafter. And that completes hyperparathyroidism. Next video will be hypoparathyroidism.